Time to be here with us today.
Thanks for having me.
Of course. And first off, I do want to give kind of an overall view and get your take here about the current state of the healthcare system here in the U.S. Break down the overall analysis there.
Sure. So the Affordable Care Act, or Insure, is basically the insurance that covers American lives for those that can't get insurance with their employer, or they're transitioning to a job, they're having some type of financial hardship. So that covers about anywhere between 20 to 40 million American lives. And the bottom line is that the government provides financial funding through subsidies to be able to support the Affordable Care Act. And right now what's happening in Congress ultimately is that the Democrats are pushing to extend those subsidies, whereas the Republicans don't want to do that. And the reason why the Republicans don't want to do that is because their perspective is they want to have less government, federal government involvement. They're concerned that, just extending the subsidies really treats the symptom, not the causal problem at the root cause, which is really that healthcare is expensive because of the fact that insurers provide a lot of comprehensive care that most patients don't even use. There's not a lot of transparency in drug pricing. So Republicans are looking at this and saying, even if we expand the subsidies, this is not going to solve the problem in the long term, and it's not going to put money in the pockets of Americans. And they're looking at other ways, like, for example, HSA plans and things like that, to be able to deal with the issue. So in a lot of ways, it's kind of a classic philosophy in the difference between Democrats and Republicans, right? Democrats support more federal government involvement. Republicans don't. But at the end of the day, this is what it means. If they don't extend those subsidies or don't solve this issue, premiums for Americans are going to go up. And that's the bottom line.
And I did want to ask here, because we talked a little bit about the differences there, but are there any similarities between the plans, proposals, and what Democrats and Republicans do want here?
Well, they both believe that it's important to make sure Americans don't pay a higher premium. I think the issue is the way they're going about it is different, right? Again, the Republicans are looking at using things like health savings accounts, HSAs, promoting state flexibility, for example, like broader waivers and redesigning coverage, putting more of it in the state's hands. But they both agree, ultimately, that they don't want Americans to pay more out of pocket. But again, the issue is, why are Americans paying more out of pocket? And from the Republican standpoint, it's really because of some of the underlying issues in terms of payers and insurers and how they come up with the cost for healthcare. Because what a lot of people don't realize is, if you think about it, when you go get a treatment, either at a private healthcare facility or you go to the ER, you don't actually know the cost of what it is your insurance company is going to be covering or you're going to be paying till after the fact. If you ever think about that, right? You know what the cost is after the service is provided, not before, like most other types of services. And so I think the concern is in terms of transparency of cost and how that cost comes about. They feel like that issue needs to be dealt with as well. But again, in the end of the day, we do need to solve this issue because we don't want the premium going up for millions of people who rely on this.
And can you kind of break down here how all of this plays out over the next, I would say, several weeks as we get closer to the deadline? You talked about kind of the impact there for Americans, but it seems as though a lot of people are just kind of getting bits and pieces of this and don't have maybe necessarily a full grasp of how many people will be impacted and really how.
Yeah, that's a great question. First, like I mentioned, the premiums. You could see double-digit premium increases, especially for middle-income households. People that are between the ages of 50 to 64, I think are going to get hit the hardest because, again, their enrollment's going to decline. The second thing I think that you're going to see is a sicker risk pool, right, if health consumers drop coverage. Because remember, if patients can't get access to care, that can cause them to have lower healthcare quality. The other thing potentially, too, is you're going to see Medicaid cliffs, right? During a lot of these ongoing Medicaid redeterminations, a lot of people could lose Medicaid coverage that relies on the exchange in the marketplace with ACA. And then I think, outside of all that, in terms of what it means for patients, a political fallout. I mean, in the end of the day, we all know that healthcare affordability and healthcare in general has always been a frontline election issue. So right now, both parties face a lot of pressure from constituents because as the premiums rise, again, ultimately, that's not going to be good for either party.
Any areas where you could see, as you analyze this, someone actually making a compromise between the two parties? Is there any real shot here?
You know, the debate necessarily isn't about whether the Americans need affordable health care. Both sides agree on that. The disagreement is about how to get there. I mean, Democrats want to strengthen and expand the ACMA, but the Republicans, again, want a more flexible market-based approach. If, again, Congress doesn't reach a deal, premiums are going to go up. But at the end of the day, I think the concern here is how do we come to the table and find some level of compromise? And I think there is some type of compromise where potentially we can extend those subsidies with some type of filter in place where Americans still have that flexibility of maybe using things like an HSA account, being able to filter it based on the types of services, whether it's medical, diagnostic, or prescription-based services. So I think, from my perspective, the compromises around the subsidies, yes, extend the subsidies, but maybe put some guardrails in place so that costs aren't, exorbitantly high for the federal government. To me, from my standpoint, that's the middle ground.
When you look at this a little bit further, as I mentioned, people get bits and pieces and a little bit of information at a time. You also have social media where people share things that aren't necessarily correct. Is there anything that maybe the American public misunderstands about this overall? Maybe a point or two that you want to make sure to clarify here?
Yeah, it's a great question. One of the things that I think people have a myth about when it comes to ACA is that not everyone is eligible for it, and it only depends on your financial circumstances. And that's one component or one variable. But it also, what people need to know is that if you don't get insurance through your employer, if you don't get insurance through the government, through Medicare or Medicaid, this is a viable option. So I think that's the first thing that people should be aware of, is that, this provides a marketplace that gives you options to choose from when it comes to healthcare. The second thing I think is that people don't know, and this is really important, they don't know that you can negotiate price with the healthcare provider. So when you go to your healthcare provider, if you have to get a colonoscopy, you have to get an MRI, or you're getting some type of service, you can ask, what is the cost? What is this going to cost me? And can I, and I want to negotiate the cost. And this is something that a lot of Americans just aren't used to. Again, we take the price de facto and we just accept it after the fact, but you have the power as the consumer to raise your hand and say, I need to negotiate that cost, or shop around and go to different places for lower costs. I think that's a really important one.
Why should Americans be paying attention to this? Because a lot of times you hear about these complicated subjects and you see, once again, what's written there on social media. You read a few news stories and maybe you're confused about it and don't look into it further. So why is it so important for the American public to be educated on this, but also to kind of watch how all of this does play out?
Because it impacts everybody. Remember, right now, the baby boomers, they're in their mid 70s, and they're the ones that are really getting the most amount of care from the healthcare system. They're going through a lot of situations where they have comorbid conditions, chronic diseases. So a lot of care is being, or a lot of cost rather is being spent on the care of baby boomers. And if the healthcare system can't get its expenditures in place in the right way, it impacts us all in terms of taxes, in terms of the burden that we pay, which we all share as a country, pocket costs from a tax perspective. So it's important for everybody to pay attention. And I think the second big reason is that healthcare spending in general in the United States is much, much higher per capita versus any other country. And that's a concern. How are we going to curb some of these costs long term, again, as the population continues to age and as these diseases that are treated currently continue to expand in terms of overall cost? It's something that we have to deal with.
I brought up social media and the posts there that do have a lot of details, some of which, as I mentioned, are not necessarily accurate. So as someone who does educate people about this topic here, how do you kind of combat that and make sure people understand what is true versus what they're reading on maybe Facebook, Instagram, Twitter, X, all of that?
That's a great question. One of the things that we do at the ACMA is we provide a lot of information for free online that people can get access to. And we do this, really because we believe that in the end of the day, you need to raise the bar and raise standards in the community in terms of education to help overall healthcare quality. And we do that through certification, through training. I believe that's really, really important. You'd be surprised. The number one reason for care delay in the United States is prior authorization denial, and this is one of the reasons why we certify and train prior authorization specialists around the world to make sure that patients have access to care. So from my standpoint, education, education, education. It's really important that if you're a consumer, understand the healthcare system, understand how the U.S. healthcare system works. And now, as you mentioned, with social media, there's a lot of good places you can go online to find accurate information and kind of filter information out from what's not real to the information that's more accurate. So I would encourage folks to just go online, Google ACMA, prior authorization, U.S. healthcare system. You'll find a lot of good information there for free.
All right. Anything else you want to make sure that people know here, the American public, as we watch all of this play out here over the next several days, weeks, and possibly months?
I think we say a prayer and hope that folks compromise on both sides. I know the president's looking to get involved, which I think is important. And let's hope that we can solve this issue because, like I said, it impacts millions of people.
All right. Dr. William Soliman there with the Accreditation Council for Medical Affairs. Thank you so much for taking the time to join us here and helping to break it all down. We definitely appreciate it.
My pleasure. Thanks for having me.